G'day, my name's Jack Wallace. I'm a community advocate for people with Hepatitis C, and I have Hepatitis C. And the key issue that I'm interested in with Hepatitis C is mainly around stigma, discrimination and access to health services. I was infected with Hepatitis C in about 1981, although the dates are a bit fuzzy. I was injecting drugs at the time, and several of my friends and the people that I were injecting with came down with non-A, non-B. At the time I didn't notice, but I suspect that I was infected with Hepatitis C from then. In terms of how Hepatitis C has affected my life, at one level it's had minimal effect. In fact, that I'm not a very good hepatitis patient. I very rarely go to the doctor to get my hepatitis monitored, and yet I've also made a career out of having hepatitis C. So part of my involvement in the community around hepatitis C has been advocating for people with hepatitis C at both a national level and at a state level in Victoria. I established the Hepatitis Australia in Canberra in 1996, and that organisation represented people with hepatitis C and developed a range of kind of written resources for people with hepatitis C. And I've been on a range of ministerial advisory committees. One of the fantastic things about Australia's healthcare system, and in terms of its response to hepatitis, has been the involvement of people with hepatitis C within the public policy response. And I'm supporting Hep Heroes because I think it's really important that people with hepatitis C are visible, and that I may look like a middle-aged, middle-class man, but I've got hepatitis C, which is, and even the way that I said that, but I have hepatitis C, indicates the fact that for many people with hepatitis C, we feel a bit different from the rest of the community because of our histories and because of the virus that we live with. For me, hepatitis C hasn't had that much of an impact on my life physically, but in terms of emotionally and mentally, yeah, it has. I've always kind of never been ashamed of the fact that I injected drugs in my early 20s and my late teens. And in saying that I have no shame around injecting drug use, a few years ago I was living in a small country town and I needed to get a liver biopsy. And I was living alone, and there's a small risk with liver biopsy of bleeding. And so I felt like I needed to ask my neighbours to look in on me to make sure that I hadn't bled to death overnight. And I was really ashamed. I was so embarrassed about having to disclose to them the fact that I was having a liver biopsy and why it was that I was having a liver biopsy. And the reality is that they saw me as a person who needed some help, and that they were really supportive of me getting the liver biopsy, and they came in and checked in on me the next morning, and they were absolutely fine. It was my fear that was the issue around disclosing to someone the fact that I had hepatitis C, and in disclosing that I was disclosing injecting drug use, that I had injected drugs. I want people to know, and I want the community to recognise that I'm a valid human being. I have hepatitis C, and there's nothing to be ashamed about.